Nicole and I'm the coordinator for the Rural InReach program, and I'm here today with Michelle McClure and Dr. Kathy Rainbird, and they're both from the Southwest WA Medicare Local, and we're here to discuss improving your health with eHealth. But firstly, I just would like to know, what are your roles with the Southwest WA Medicare Locals?
Thanks, Nicole. Yes, Kathy and I are actually a part of the eHealth team for the Southwest WA Medicare Local, and we're actually a part of a team that's helping implement the eHealth record through our region. So we're actually working with healthcare professionals, getting them ready for eHealth, and also creating awareness with consumers around the benefits for having an eHealth record.
Thank you. And your role, Kathy?
I'm part of that team, so we're out there visiting GPs and other health professionals, spreading the word, and also doing things like this to make people aware of the eHealth record and letting them know what's going on with it.
Okay, great. Well, I think that, that's a really good question, is what is eHealth? What is an eHealth record?
In a nutshell, it's the way that people can share their health information amongst their various healthcare professionals. So we all go and visit a GP, but we also see a pharmacist. We might also sometimes have to go to hospital. We might see a physio or an optometrist or a dentist, and they all have their individual record systems where they secure our medical records. And this is a way of securing it in one place, in a summary, so everyone can access that information.
Okay, so it's helpful so that an individual doesn't have to tell their story 20 times, that everyone has, in terms of health professionals, they all have access to the same information.
Exactly right, yeah. It's improving that communication between all the different healthcare professionals, and so you've got this certain medication, your GP's recorded on your eHealth record, and everyone else can see what that medication is and what the dosage is, for instance.
So why else is it important for people to use eHealth?
Well, I think it's besides connecting all the health providers and having them have access, it's also important for consumers of health services to actually feel that they've got some control over it. So with this record, they're able to actually go online themselves and have a look, so they can see what health providers have actually put on their record, so they can keep track of things and have more control around that, which is really, nowadays we need to be more consumer focused. People need to be able to have that access and that control over it's their health, so it's important.
Okay, what about privacy though? Because I think that's something that people would be concerned about if lots of health professionals are knowing all of the same information. I'd be curious to hear about privacy and confidentiality.
And that relates into the whole idea of this record being what's called personally controlled. So each person can set individually who they want to allow to have access to their record. It is only accessible by healthcare professionals, so other people can't just hop on and have a look. You can access your own record, and then you can set the levels of who else can access. So you can say, yes, I want my GP or my other health professionals to have open access to everything, or I don't think I need my podiatrist to know that I'm also going to see a counsellor, and so you can block that and restrict the access if you want to.
Okay, that's great. So what's in place to help people around that controlling their own eHealth record?
There's an online learning centre, so people can, when they register for an eHealth record, you can do it online, and there's also a learning centre online, so you can find out all the different ways of controlling the record for yourself.
Okay, what about if they don't have access to the internet?
The eHealth record, if it's an opt-in system, so if people don't want to have an electronic health record, they don't have to. It is a choice, and if they choose to have one but they don't have access to an internet or something to look at their record, what they can do is they can still register for one through Medicare or perhaps through their GP, somewhere like that, and then what happens is that they won't then have the internet access unless they actually go to a centre that they can log onto a computer and have a look at it. But it can still work. They can still set their default settings and everything, their access settings, so it can be used without them regularly going online and checking it.
Okay, so are you saying then, Michelle, that it's not compulsory, that not everyone has to have an eHealth record?
No.
Okay. So right now, a GP can add to an eHealth record. If someone registers, that automatically transfers the pre-existing information and then it gets added to, or is it just starting from now?
There's a range of information that the record can contain, and some of it is automatically brought in from Medicare when you register, but most of the information is dependent on the healthcare professional actually putting the information onto the record. So at the moment, if you register yourself and then go and have a look, it looks very bare apart from that automatic information that's come across. For instance, for your children, there'll be information about their immunisations that's linked into the immunisation register, but otherwise there's not much. And it's up to you to then go to your GP and say, I've got an eHealth record and I'd like you to put a summary of my information onto that. And then as it builds up and more health professionals become involved, hopefully it'll become sort of more routine part of the practice to put the information on there, but it only will have that information that people put in.
Which really reinforces that whole notion of being consumer driven.
Yes.
Exactly.
It sounds like there's a lot of responsibility on the consumer to ensure that information is requested to go on, but is there stuff in place for the GPs or the health professionals in general to get that information up there?
So there's been quite a lot of work. We've been working closely with the GPs in the region to get them into doing eHealth and eHealth ready, and it's been quite a process for them because of the background sort of security behind the computer systems for their organisations to become eHealth ready. So they're really just at the starting point of getting on to being able to put the information up, but basically their computer systems can show them that an eHealth record exists. So if we have a look at one of the slides we've brought along, I'll just pull it out, this one. This is the sort of information that a GP might have in their system at the practice. And on this screen you can see there's a little green button which says an eHealth record exists. So that can sort of be a bit of an alert to the GP to say, oh, I can see you've got an eHealth record, do you want me to put your information across? So it can come from both sides. And then the GP can create what's called a shared health summary, which then summarises that person's background, medical history, their allergies and that sort of information, and then that can be automatically then uploaded from their system into the eHealth record.
I think once again one of the really great things around this is around that fostering that communication with the GPs, and we're definitely encouraging GPs to have conversations with their patients about it, and I think it's really important that they have those conversations when when people visit their GP about it and about what information that they want up on their record as well. So it's hopefully it will create that better dialogue between doctors and patients as well.
Is there any case where in an emergency an eHealth record would be beneficial?
Yes, exactly. That's one of the key areas where it would be beneficial, because imagine if you're wheeled into, hopefully it never happens, wheeled into an emergency department and you're unconscious, yet they look up your record and see you've got an eHealth record, they can immediately know your past medical history. They might see that you've got an allergy to a certain medication, so they know not to administer that straight away. It's all just there. So it really is a useful tool in that situation. And there is, we should say, as part of that access restrictions, if it is an emergency and a health professional deems it as being life-threatening, then they can actually break the glass, if you like, on your record and access the full record.
Okay.
If it's that emergency situation and it's in your best interest for them to know what's going on for you.
Sure. So that sounds like to me that's a kind of like the limitations to confidentiality when you go and see any health professional, whether it's a GP or a counsellor, and you're talked through that everything that you say is just between you and and your worker, unless there is any indications that yourself or somebody else is in a position of harm, and eHealth kind of works like that to be able to provide that same sense of security and quality support.
Exactly.
And it does generate that audit trail, so people can actually see when someone's accessed their records. So that's another way that protection has been built into the system as well.
So if I have an eHealth record and I go online and I access my eHealth record, I can see who has accessed it.
Yes. So, but I just want to go back to when we were talking about the emergency situation. Something else that is on the eHealth record is around the advanced healthcare directives. So if someone does have an advanced healthcare directive, at this stage the custodian of that is recorded on the eHealth record, and so if they're in an emergency situation, then doctors can then have access to that advanced healthcare directive, which is really important, I think, for people that have made a decision about certain treatments that they do or don't want in case of an emergency situation.
Yeah, I can see how that would be beneficial, and having myself done a advanced medical directive for my mother, there's so many copies that you have to make and give them out to all of those significant people. So by having it all accessible electronically, you're not carrying that around, and there's that sense of security that it is accessible. So yeah, I'd imagine that would bring some sense of security to other people as well to know that.
And the other point, I guess, to make about the eHealth record system as it is now is that this is really just the beginning, and more information we think is going to be linked in to be able to be part of this, and it'll mean there's better communication between all the different healthcare professionals. So it's going to grow, and I think that there will be more applications via our smartphones and things like that as well, which we can link in to our eHealth record and use it in really interesting ways in the future.
Yeah, sure. So I'm hearing a lot of positives and a lot of future potential for an eHealth record, but are there any challenges or barriers that you can identify at this stage that might come up for the eHealth records?
I think some of the challenges that we're encountering around people understanding what it is and that there is security built into it, and so it is confidential, that there is privacy built around it. It does actually have its own legislation, so it is quite well supported. So there has been a bit of concern about that, but generally we find the public, the consumers, are very much in favour of it because they can see the benefit of it. They can see that when they're travelling and they visit a GP that they don't know, they have access to a record that lists their medications, and so if they happen to forget one or not have them with them, it's there for them. So consumers are actually really in favour of it. For, as Kathy mentioned earlier, for health providers, it has been quite a bit of work to get their systems up and ready. I think we have to remember that what's happened with technology for the GPs and for other healthcare providers is everyone's ended up with their own system. So what this enables is for those systems all to add and take information from one central point. So there's been a challenge around getting those people ready, but I think that it's all starting to come together now, and it will start to take off. I think there's more things coming out and being developed all the time. The baby book is going on to the eHealth record, so babies that are being born now in 20 years' time will take it for granted that they've got this eHealth record, and their information's been on it from the first day. So that's wonderful that will be able to happen for them.
That leads me to another question around children and young people. So you're saying that from pretty much now onwards, children that are born, they'll automatically have an eHealth record.
No,
is that
not
right?
automatically. The parents will have to
They need
register.
to?
So it's like
Sure.
for us as individuals, we have to go on and choose whether or not we want to
Okay.
have an eHealth record, and we can choose whether our children want our children to have one
Okay.
and register them. So it's the parents who
Okay.
make that decision.
Okay, that's good. So at what point then does that information get controlled by a young person? If the parent has chosen to register their child, at what point do they then be able to control who has access to what information?
They, at the age of 14, the child can take control, and that's fairly consistent with consent. Consent is at 16, but a child that is well informed and can make decisions are currently allowed to manage their own health, and so it was decided that 14 would be the time that children can then choose to take over their own electronic health record.
But of course they don't have to. They can leave it with their parents if they want
Yes,
to, until they turn 18.
Experience shows that they often quite willing to leave things to their parents.
Yeah, but if they want to themselves, they can choose. But who does anyone determine that at 14 that if that young person wants to, that they're able to? Like, who makes that decision?
No, that's between the child. That's totally up to the child whether they can. And I think if they can think enough about having their own electronic health record and make the decision to register on their own, then I think they're actually showing quite a high level of decision making there. So yeah.
And just relating to the other end of the spectrum, towards the elderly age group, an eHealth record is also, of course, very useful for people who are getting older and have multiple conditions, but it's also able to be set up by their children as their carers if they're not able to set one up themselves. And so people can nominate who can have access to their record or who can control it for them. So they can say, I want you as my daughter to set up the record for me, and they can do that for their elderly parents.
So it sounds like to me that an individual can determine how much control they have over it, or how little as well. They can do it as a supported process, or it can be like an individual one. So what about overseas? Like, how translatable is this record system with people who travel regularly and, you know, hopefully it doesn't happen, but you know, perhaps there is an emergency situation overseas?
Well, that brings up a good point, and I'll bring up the slide that relates to actually what it looks like. I'll just pull it up. So basically, eHealth record over the internet. So as long as you've got your password to log in, then you come to this page. So this is just an example with the fictitious person called VJ Engineer. And you can click on open your eHealth record. So anywhere that you can get internet access overseas, you can also then access your own eHealth record. So if you're travelling and something happens, you can say, well, I've got this record and this is how I can get you access, and you can then share it with your health professionals overseas. And then that is the screen that they would see in terms of an overview of your current health status. So you can see there's a summary there of your current and past medical history, the medicines you're taking, allergies and adverse reactions in immunisations. So they can access all of that information online. And if you give them your access, or if you log in, then they can see everything that's in your record.
So what I would imagine is if you were travelling overseas and you had your iPad or something like that with you, you would bring it up and show it to the medical person. They're not going to be able to add anything to it, but at least they can see the information that you have available.
What about if I come from a culturally diverse background? Is it easy to access eHealth records?
That's a good question, Nicole. At this stage, the eHealth record doesn't have different languages or anything on it, but I would hope that that's in development. But what is actually happening with Medicare Locals across Australia, that they're helping people to register. So where there's a particular population that needs assisting, they're actually looking into providing that assistance and giving education and support around it. So there is that local assistance happening, but as far as the actual eHealth record at this stage, I think that's still under development. So hopefully, fingers crossed.
Okay. I think that goes along the same line as what you were talking about before. That down the track, potentially people are going to be able to access their records from their smartphones on an app, and then same thing applies. That different languages will be able to be accessible as well.
Yeah. I mean, at this stage, it's still people, healthcare providers need to be able to access it as well. But yeah, I think there definitely is something built into it that accommodates for people from different cultures.
But what it sounds like is happening is that it is providing a bridge to that supported access to the eHealth record, as well as that supported care as well for people in general, but specifically those who come from culturally diverse backgrounds who come to Australia. So what can and can't you do with an eHealth record?
Well, I guess there's a few different levels of things that people can and can't do. The first thing you can do is decide whether or not you want to have a record in the first place, so you're choosing whether to opt in or not. But I guess if you choose to opt in and see that it's a worthwhile thing to do to share that information, you can choose which healthcare professionals can see which bits of that information. So like I said before, you might say, okay, I don't need my podiatrist to see that I've been to see a psychologist or so forth. And you can also choose at the individual sort of information level about medications, for instance, that you may or may not want to have shown on your record. One of the classic examples that we've talked about with a lot of the doctors we've been seeing is a male patient who is taking Viagra, for instance, and doesn't want that shown on his record. But the fact is that if you are taking Viagra, it can have implications if you present to emergency and then you're given some other medication, that it can be quite dangerous not to have that known to the healthcare professionals. So it's really a point of communication again with the GP, saying, well, it's actually really important that your healthcare professionals are aware that you're having this because of this potential situation that could arise if you don't.
Sure.
So it's again that importance of having that conversation and deciding what should and shouldn't be in there.
So it might limit the risk of the counteractive,
exactly.
The medications having impacts on each other.
And I think, for me personally, and I think for most people, it makes a lot of sense if you're sharing the information with your healthcare professionals and they've got their professional codes of conduct, that you say, well, for me, it's sharing that information to make my health better. So it makes sense to have it as open access to everyone and that information's out there. Yeah. But
what can't you do with an eHealth record?
So some of the concern has been around patients or consumers being able to alter the record once the health professionals put that up. And what they can do through the different access is you have different access levels for health professionals, but they actually can't alter anything that's put up there. So they're not altering any medical record or health record, which I think is really important, because health professionals that are going to be looking at the record, they need to be confident that it's information that's been put up by someone with knowledge around that particular condition or health condition. So so the consumer can't alter that record, but they can choose who sees what. So I think that's an important thing to recognise. With the personally controlled electronic health record, it's actually in two parts. There is a clinical side to it, which the patient can go have a look at and see what the health professional has put up, but there's also a personal side of it as well. So in that they can actually put in information around what over-the-counter medications they're taking, perhaps reactions they've had to medications, things like that. And they can actually, the health professional, their GP, can view that if they choose that. And there's also a private diary side. So it may be someone that has a chronic condition, and they may decide they want to diarise what is happening for them. So it's an ongoing record for them, and that's personal. It's completely blocked to health professionals. So that's just something for the person to use for their own information. And I think particularly I have a background with in cancer nursing, and I could imagine a lot of patients with cancer using that as their journal. It's there, they can access it online wherever they are, but their health professional is not privy to it.
But can they be? If that individual wants to share that with their health professional, do they have that option?
No, they don't. It is actually just, but there is that other private summary side that they can use that to share with their health professional.
Sure.
So that may be, they may have a treatment that they've not reacted well to. They can document that in there so their GP can see, oh, okay, you were sick with that certain medication. Yeah.
I can see how that could be helpful as well if you've got a lot of things going on for you in your health, that being able to record something direct into some sort of medium so that a health professional can access that when you go see them, but perhaps your appointments, 2 weeks in advance, and maybe you forget or whatever, so recording that straight into that, then that information is going to be communicated when it needs to be.
Yeah.
I think that's one of the real beauties of having the eHealth record, is that not relying on our own memories to remember all the medications. I know that a lot of them have very complicated names, and we don't always remember what they are. And with people who have even more conditions, they've got multiple medications, so that not having to rely on your memory and having it just there, so you can go, oh yes, I'm taking this, and this is what the dosage is, and here it is exactly as it is.
So you said it can't be altered yourself. A health professional can alter the record, add information, but can you change your mind? Can you deregister from an eHealth record?
Can I just answer that there was 2 parts to that?
Sure.
Health professional, once they've actually uploaded something to the personally controlled record, they can't alter it then. What they can do is add another upload to it. So they can't go and alter things that have already been put up there. So I think that's really important, in the fact that it keeps a tracking of what actually is going on.
Which is like that auditing process that you're talking about. Yeah.
So it adds transparency, I suppose, to the whole process. So I think that's really important. Sorry, I've forgotten the second part of the question.
It was just around, and I appreciate that you really clarified that, because I think that's important. It's to know that once something's up there on the record, that's there, that's been recorded, not only for the client or the individual to be able to access that information for the transparency, but also so that there is accountability as well.
Yes.
My question was more around the deregistering.
Oh, okay.
Is that possible?
Yes. People can opt out whenever they want to, and they can reactivate too, I believe. I don't know a lot about that, but I understand they may choose, for whatever reason, that they don't, they no longer want an eHealth record, but then a month or 2 years later or whatever, they can actually go back and reactivate it if they change their mind.
So it is really consumer driven, and there's a lot of free will there. Well, I suppose that leads to our last question, is how do you register for an eHealth record?
And there's a number of different ways that people can register for an eHealth record. If we bring up the slide, you can see here that you can go online to www.ehealth.gov.au. There's a bit of a process because you have to prove your identification and go through that sort of check. There's also a 1800 phone number. or you can go in person into your Medicare office and say, I want to set up an eHealth record, and they can do that identification check. You can go the really old-fashioned way and fill in a form. There's a form available. Again, I think it's available through the Medicare office, and you can take that away and then fill it in. And the other thing, as we mentioned before, is through assisted registrations perhaps at your GP's practice, and you can say, I'd like to set this up and can you help me do that? Not all practices are ready to do it yet, but we're in the process of training them up in terms of being able to do that, and then you'll be able to fill in the form there and they'll be able to put you straight into the system, and then they'll be able to upload to your records straight away.
And I think particularly with the assisted registration, that's where Medicare Locals have been assisting particular populations that would benefit from an eHealth record. So once again, that's going back perhaps to your earlier question around culturally diverse communities, that's where Medicare Locals have actually been doing the assisted registrations and going out and assisting people that may have lack of access to computers, but also have literacy rates and things like that, but would really benefit from having an eHealth record, because then when they do visit someone, there's a list of medications and their previous health problems. So Medicare Locals are doing that across Australia.
Well, thank you. It sounds like you're working really hard to ensure that everyone has access to information, regardless of who they are, in terms of whether they're health professionals or community members. Is there anything else that you think is important for people to know about an eHealth record?
I think it just comes back to that overarching picture of why have one, and it's to make the whole health system better connected, and I think that better connection means better health in a nutshell.
Okay. Oh, well, thank you very much, Michelle and Kathy.
Thank you.
Thank you.
Today we've been talking about improving your health with eHealth, and I'd like to thank Michelle and Kathy for your time today.
Thank you, Nicole.
Thank you.
You're welcome. And I'm Nicole, I'm the coordinator for Rural InReach, and if you have any questions in general about the program, please call 1800 998 399, or you can go straight onto our website ruralinreach.whfs.org.au. Thank you very much for your time today. See you next time.